friends. Welcome to our next discussion, and the topic is bupropion effective for generalized anxiety disorder? And I am Dr. Harvinder Singh. Actually, this presentation is a part of this lecture series in our Psychiatry Education Forum Academy, where I discussed on the treatment algorithm for generalized anxiety disorder. This is actually a three-part lecture series where first I will talk about initial medication of choice, like which medication to start, and what augmentation and switch options are there. And this is a table that I discussed this topic in. And bupropion is actually in the switch option in this table. So let's spend some time on understanding if bupropion is effective for generalized anxiety disorder. If you're interested in learning more about the Academy, please read more details below. Moving on to next option, bupropion. Not as an augmentation agent, only as a switch option. Now, this is interesting, and I'll talk about that in a few minutes. But before that, let's go over Canadian Clinical Practice Guidelines. They marks the extended release XL formulation of bupropion as a second-line treatment here. So it's not FDA approved for GAD though, but we all have this misconception that bupropion can worsen the anxiety. Is that really true? Well, let's go over the studies that the Canadian Clinical Practice Guideline based their decision to mark this as a second-line treatment for GAD. So this first study was published in 2008. This was a pooled analysis of 10 studies comparing the efficacy of bupropion and SSRI for the treatment of MDD with high level of anxiety. They label it as anxious depression. What did they found? Well, this is an interesting thing. They only found modest advantage of SSRI compared to bupropion, only 6% difference in response rate in the treatment of anxious depression. So, there's not a big difference there in response. We can't ignore that. And looking at NNT, number needed to treat, nearly 17 patients needs to be treated with SSRI, then bupropion, in order to get one additional responder. And the last but not the least is there is no statistically significant difference in efficacy between bupropion and SSRI in patients with low or moderate level of anxiety. This is important, I think, not the severe level of anxiety, but low or moderate level of anxiety. So let's say if you're using the GAD-7 to measure the anxiety level, I will say less than 15 of GAD-7, considering bupropion is a good option in those patients. Now, very quickly about the dosing, we all know it. Initiating dose varies depending on XL, SR, or IR formulation. And you can aim for 150 to 300 milligram of XL formulation. The reason I'm saying XL is because the Canadian Clinical Practice Guideline have only marked XL as the medication of choice here. Side effects, we are all well aware: weight loss, appetite suppression, sleep disturbance, worsening obsession or compulsion, and related side effect. But this is a very beneficial medication in patients with comorbid inattention issues. It can be used for antidepressant-induced sexual side effect, and as a medication of choice for no or less sexual side effects. Also has approval for smoking cessation. So keep that full patient profile in mind when switching to bupropion.